So what I use to help increase human growth hormone production and help optimize human growth hormone levels is something called Sermorelin. But before I talk about what Sermorelin is and how it works, I think it's important to understand how our body naturally produces human growth hormone. When we're young, we produce a lot of human growth hormone, and as we age, we produce less. And this is just another one of those hormones that we produce less of when we're older, and it's one of the hormones that helps build us up and keep us healthy. But unfortunately, our production of it declines as we age. So I got through medical school by drawing pictures for myself. So you're going to be subjected to some very poor artwork, but this is my artist representation of you. Okay, that's you, and here is your brain. Now the brain contains two important structures, one being the hypothalamus and the other one being the pituitary. And a lot of hormone systems are regulated and controlled through these two structures. But with respect to human growth hormone production, what happens is the hypothalamus releases a hormone called growth hormone releasing hormone. And what it does is signals the pituitary to produce and release human growth hormone. And once released, human growth hormone goes off into your body and does all those wonderful things I was talking about, like helping with energy and focus, body composition, burning fat and building muscle. It can help build bone. It can help support your immune system, helps with sleep and skin health. These are all, it can help tissue recover faster. So again, these are all very youthful qualities and things we lose as we age. So another hormone that comes into play is a hormone also released by the hypothalamus called growth hormone inhibiting hormone. And you could think of this as the off switch. So growth hormone releasing hormone is the on switch for the system, and growth hormone inhibiting hormone is the off switch. And so what happens is we normally release this hormone in pulses or a burst release. And we get a release of growth hormone releasing hormone that triggers the release of human growth hormone, and then the system gets shut off by growth hormone inhibiting hormone. So you get this surge release of human growth hormone. It goes off and does all these great things in your body, and then it goes away. So what I use is Sermorelin, which is not easy to write upside down, but I'm going to do my best here. So what Sermorelin is an analog of growth hormone releasing hormone, or basically it is this. If you were to take a molecule of growth hormone releasing hormone, Sermorelin is the active portion of it. I also formulate this with some other proteins. There's GHRP6 and GHRP2. These are also analogs of hormones that naturally occur in your body. And these all directly stimulate the pituitary to produce and release human growth hormone. So basically what you're doing is augmenting the effect of this naturally occurring hormone. There's also some properties in these proteins that help block the off switch. So what you're getting essentially is you're producing your own surge release of human growth hormone. You're producing a burst by turning on the on switch and blocking the off switch. And what's nice is this does not stay in your body very long. So it produces a short-term release of human growth hormone that natural sort of matches how your natural physiology works. The problem with people when they were injecting human growth hormone is they usually would get a very excessively high level of human growth hormone that they would inject, something your body's not naturally used to seeing. And it would stay in the system much longer than your natural human growth hormone would. So you would get some positive effects, but you also would get some side effects from just an unnatural process going on in your body. Using Sermorelin most closely mimics how your own natural physiology works. So you're getting the benefits of increasing human growth hormone production and optimizing the levels, and minimizing your risk for side effects. One other thing that human growth hormone does is it triggers the release of another hormone, IGF-1, and also a protein, IGF binding protein 3. Now, these are important because human growth hormone does not stay around in your body very long. It does what it does and it goes away, and it's very difficult to measure and track how your production is. This usually happens late at night or very early in the morning, and it's difficult to time when you should test this level. However, it triggers the release of these, this hormone and this protein, and these stick around a lot longer. In fact, this is probably the best way to track your HGH activity. These levels stay elevated longer, and you're able to measure them as a direct correlation of HGH production. So that's why we follow these. And looking at your tests, you know, your IGF-1 level and your IGF binding protein 3 level, they're within the normal range, but they're kind of low in the normal range, which makes you a candidate for Sermorelin therapy.